All right, our next presenter is Dr. Arlen Myers. He is the President and CEO, Society of Physician Entrepreneurs, and he is Board Chair Emeritus of GlobalMindED.
Thanks very much, and thanks for being here. As you can see, I am not Pierre Theodore in your program, so don't be confused. I'm not an AI avatar, it's actually me. So it's my pleasure to introduce a colleague, Dr. Yele Aluko, a proven physician executive and leader who has dedicated his career to advancing health outcomes and championing health equity on a global scale, which is actually why I actually joined GlobalMindED and got involved with Carol, because our missions sort of overlapped to create a talent pipeline for sick care. With over 35 years of expertise, Dr. Aluko has made an indelible impact locally, globally, and across every space in between, from advocating for equity as one of few black cardiologists in Charlotte in the 90s to shaping global conversations on health equity as the Chief Medical Officer of Ernst & Young Americas today. His leadership has been both visionary and deeply effective. After 25 years practicing cardiovascular medicine and leading clinical strategy, operations, and care delivery across a 15-hospital, 4-state network, Dr. Yele Aluko made a purposeful transition from clinical practice to corporate industry, which is a career track very close to my heart. He often credits his business school training for expanding his perspective and equipping him to tackle complex challenges across the health ecosystem with innovative systems-level solutions. As the founder and director of EY's Center for Health Equity, Dr. Aluko has guided organizations across the healthcare spectrum to recognize that closing health gaps is not only the right thing to do, it's a strategic business imperative. Today, we honor Dr. Aluko with the GlobalMindED Inclusive Leader Award for Health and Wellness. His work exemplifies the power of inclusive leadership, proving that a commitment to equity and measurable sustainable impact can drive meaningful change in a healthier future for all. Please welcome a colleague and physician entrepreneur, Dr. Aluko.
Thank you, Dr. Myers, for that generous introduction, and good evening to everybody. I'm proud of you, students and youth who are here today. I am very honored to receive this award. I'm humbled, and this award, the GlobalMindED Inclusive Leader Award for Health and Wellness, it is more than a personal milestone for me. This recognition is one that must include the many mentors, many colleagues who have lifted me up, many supporters, and my teammates when I practiced cardiovascular medicine that nurtured me and matured me in the art of bedside care, and my teammates currently at the EY Center for Health Equity. These are collective efforts of many individuals and organizations working now to advance health equity across America and hopefully at some point in the future across the globe. I acknowledge that I'm not talking to a medical audience, so I will crave your indulgence for me to define what health equity is. Health equity is a situation where every human being, irrespective of their social designation, socioeconomic background, race, ethnicity, gender, or any so-called vulnerable demographic, has the same access to health care, has the same opportunity to be treated fairly within a health system, so that they achieve the same health outcomes across all dimensions of clinical care, be it cardiovascular medicine, be it maternal mortality, be it infant mortality, diabetes, cardiometabolic disease, anything. We have a gross disparity in health outcomes in the United States, and it should not be that way, because in America, we have the largest economy in the world. We spend $4 trillion on healthcare, and our outcomes pale in comparison to the best practices in Norway, Sweden, Japan, Korea. Indeed, the United States ranks in the bottom 20% of health outcomes performance, of health systems efficiency, of access to healthcare, and equitable healthcare. So with the amount of money we have to invest in the industry and the outcomes that we get from the industry, it is clear to all that we do not receive value. And demographics such as race and ethnicity, LGBTQ, the elderly, the disabled, the homeless, bear the worst brunt of this conundrum. So when we talk about health equity, we're talking about recalibrating the opportunity. So these challenges have existed since the inception of organized medicine. This is nothing new. What is new is the designation health equity. And we must reflect on the fact that back in the day when I was a fellow in the 1990s, we talked about racism in healthcare. That was a connotation that didn't go far because it was toxic. And it didn't get embracement from broad society. It was accusatory. But the truth is that there was racism in healthcare, and the truth is that there's racism in society. However, that designation over years morphed to the elimination of racial and ethnic disparities in medicine. It was more palatable because scientists got together to talk about how do we eliminate racial and ethnic disparities in medicine. There was much interest from researchers, but not from bread and butter frontline practitioners. That designation morphs to health equity. I say that to say that we should not get caught up in verbiage. We need to understand exactly why we have the problem. And the problem stems from upstream drivers for what we call the political determinants of health. How resources are allocated, how decisions are made, how relationships are built that result in who gets housing that is affordable, where is transportation allocated to, where the grocery stores get to. I think I'm overstaying my time, so I will wrap up. So, I want to remind the youth in particular that you are on a journey that us have been on before. And there is no linear journey to the true north. You should anticipate setbacks and fallbacks, but you must be focused and be resilient and be steadfast. I want to remind you to learn how you should manage your manners because they define your character. Learn how to manage your money because financial stewardship. Thank you very much.